Before you do anything else right now, hold up one of your hands and look at it carefully. Not a quick glance, a real, deliberate, unhurried look at each fingernail, one at a time, because in the next several minutes, something is going to be explained to you that most people over 60 have never been told, something that cardiologists observe in clinical practice every single day, but rarely take the time to sit down and explain properly to their patients. Your fingernails have been quietly recording what your heart and blood vessels are doing. They have been doing it your entire life. And if you know precisely what to look for, they can warn you about a cardiovascular crisis before that crisis ever happens. I am a physician who has spent years working with adults over 60 on preventive cardiovascular care. And something I see repeatedly in this work genuinely troubles me. People come in after a heart attack or a stroke, and when I examined them carefully, the warning signs were already written on their nails, sometimes months before the event, sometimes years. Nobody had noticed. Nobody had told them what to look for. That ends today. Stay with me through every sign, because the final one I cover is the one that consistently shocks people most. And I am going to teach you a test you can perform on yourself right now using nothing but your own hands that directly measures how well your smallest blood vessels are functioning. Let us start with the biology, because understanding why your nails carry this information changes how seriously you take what you are about to see. Your nails grow from a structure called the nail matrix, sitting just beneath the base of each nail. The cells in that matrix are in direct, constant contact with your bloodstream, nourished by the smallest blood vessels in your entire body, the capillaries running beneath your nail bed. Because those vessels are so extraordinarily fine, they are among the very first structures in the body to show stress when your cardiovascular system begins to struggle. Think of your nails as a live monitoring system your body has been running quietly and continuously every day of your life. After 60, this matters more than it did in younger decades. In your 30s and 40s, your heart can quietly compensate for early dysfunction for years without any visible signal appearing anywhere. After 60, those physiological reserves are thinner. Warning signals begin surfacing earlier, and your nails are frequently where they appear first. A standard 15-minute medical appointment cannot cover everything, and nail examination rarely makes the priority list unless something is dramatically and obviously wrong. The clinical information exists in the research literature. It simply never reaches the person sitting at home who actually needs it. Closing that gap is exactly what this is for. The first sign is called Terry's nails. This is not a term most people have encountered, but once you know it, you will look at hands differently for the rest of your life. Terry's nails occur when the entire surface of the nail takes on an opaque, whitish, or very pale appearance, almost like frosted glass, with one defining feature at the very tip, a narrow strip of pink or reddish color at the far edge of the nail, usually just a few millimeters wide. That strip at the tip is the detail that separates Terry's nails from ordinary pale nails. Look for it specifically. Without it, pale nails are simply pale. With it, you have Terry's nails. Research published in Cardiovascular Medicine has identified Terry's nails as significantly associated with coronary artery disease, heart failure, and diabetes. One study found that people with Terry's nails had an odds ratio of over 6 for coronary artery disease compared to those without them. That is not a minor statistical footnote. An odds ratio above 6 is a major clinical signal, and every condition linked to Terry's nails shares one characteristic that makes the nail sign so strategically important. These conditions develop slowly and silently over years before anything dramatic happens. The nail change appears during that silent period, which is precisely when intervention is most effective. A patient, I will call him Robert, came to see me at 71 with no dramatic complaints. He felt reasonably well, but had been more fatigued than usual over the preceding months, something he had naturally attributed to age and to a busier schedule. During the examination, I noticed his nails were unusually pale with that characteristic reddish strip at the tip. I asked careful questions about his symptoms and ordered an echocardiogram. The results revealed early stage heart failure that had been developing quietly for close to 2 years without any obvious presenting symptoms. Robert received the right treatment at the right time because of what his nails made visible. He is doing very well today. His fingernails opened the conversation that made that possible. The second sign is called Lindsay's nails, sometimes referred to as half and half nails, and the appearance is distinctive enough that you will recognize it immediately once you know what you are looking for. The nail is divided into two clearly visible zones. The half of the nail closest to your cuticle is white or very pale. The half closest to the tip is a brownish red color. The dividing line between the two zones is usually sharp, clear, and consistent across the nail. Lindsay's nails have been associated in clinical research with heart failure and liver disease, and they tend to appear after the body has been under sustained circulatory stress for an extended period. Both Terry's nails and Lindsay's nails are disorders of nail bed color. Both reflect how effectively blood is reaching and nourishing the smallest tissues in your body. When circulation to the fingertips is compromised over a sustained period, the nail bed loses its normal healthy pink appearance and begins displaying these altered patterns instead. Both signs are visible in ordinary daylight without any equipment whatsoever. Hold your hand under good natural light right now and look carefully at each nail. You can check for both of these signs in under 30 seconds. Do it while the descriptions are still fresh in your mind. The third sign is called Muirca's lines. These are multiple horizontal white lines running across the nail parallel to the lunula, which is the small crescent-shaped pale area at the base of your nail. Muirca's lines do not feel raised when you run your finger across them. You can see them clearly, but the surface of the nail feels smooth to the touch. This is one of the key details that distinguishes them from other types of nail changes. They are a visual signal, not a textural one. What makes Muirca's lines particularly significant is the research connecting them to cardiovascular disease. Studies examining the relationship between nail findings and cardiovascular status found that these lines were a statistically significant predictor of heart failure with an odds ratio approaching 6. The underlying mechanism is that these lines reflect low albumin levels in the blood, a marker of the body being under prolonged nutritional and circulatory stress. When the heart is struggling to circulate blood efficiently throughout the body, the tissues furthest from the heart begin to feel the consequences first, including the nail matrix where new nail cells are produced. A patient I will call Catherine came to see me at 68. She was active, not overweight, and genuinely felt well. During the appointment, she mentioned almost as an aside that she had noticed some horizontal lines on her nails over the past few months and had assumed it was probably nothing, possibly just a dietary deficiency. I looked carefully and recognized Mirka's lines across several fingers. A cardiovascular evaluation revealed early heart failure, entirely manageable at that stage because it was caught before significant damage had accumulated. The lines had been appearing for months. Her body had been quietly requesting attention during all of that time. It just needed someone who knew how to read the request. The fourth sign tells a different story from the others, and understanding this difference matters. This sign is called Bowes lines. Where most nail signs build gradually and reflect chronic developing conditions, Bowes lines appear in response to a specific event. They are horizontal grooves or depressions running across the nail plate, physically indented rather than just discolored, and you can feel them when you run a fingernail across the surface. They appear because when the body undergoes a significant physiological shock, a heart attack, cardiac surgery, a severe systemic infection, or any major health crisis, the nail matrix briefly stops producing new nail tissue entirely. When growth resumes, the pause leaves a physical groove behind. Over time, that groove grows outward toward the tip of the nail, and its position along the nail can actually help estimate approximately when the event occurred, because nails grow at a relatively predictable rate of about 3 millimeters per month. What makes Bowes lines clinically important is that they can reveal a past cardiac event that the patient themselves never recognized as a heart attack. Silent heart attacks are more common than most people realize, particularly in older adults, where the classic dramatic symptoms, the crushing chest pain, the left arm radiation, are frequently absent or so mild they are attributed to something else entirely. A patient I will call Harold came in for something entirely unrelated to his heart. I noticed a clear horizontal groove running across nearly all of his fingernails. I asked about it. After some reflection, he recalled being seriously unwell about 4 months earlier with what he had assumed at the time was an unusually severe case of influenza. Testing revealed he had experienced a silent heart attack during that illness. His Bowes lines told the story that his symptoms had never told clearly enough for him to recognize what was happening. The fifth sign requires you to look beneath the nail surface rather than at it. These are called splinter hemorrhages, and they look precisely as the name suggests. tiny dark splinters or very thin dark lines running vertically beneath the nail, visible through the nail surface as small collections of blood trapped in the capillaries of the nail bed. A single splinter hemorrhage following obvious physical trauma to the hand is not concerning. Multiple unexplained splinter hemorrhages appearing across several fingers without any injury history is an entirely different clinical picture. In medical training, unexplained splinter hemorrhages across multiple nails are classically associated with infective endocarditis, an infection of the inner lining of the heart's chambers and valves. This condition develops when bacteria enter the bloodstream and attach to damaged heart tissue. The infection produces tiny clots that travel to distant blood vessels throughout the body, including the minute capillaries in your nail bed, where they become trapped and visible as these dark vertical lines. Infective endocarditis is serious and requires urgent medical attention when identified. A patient I will call Francis noticed these dark lines on several nails and mentioned them during an appointment focused on something completely different. She had almost not mentioned it at all, assuming it was cosmetic and irrelevant. She was diagnosed with a heart valve infection that was caught in time to treat effectively. She told me afterward that she had noticed the lines for several weeks before her appointment and had nearly convinced herself to say nothing about them. The sixth sign is one that most people look at every day without registering what they are seeing. Look at the base of each nail right now. There's a small whitish crescent shape there, most visible on the thumbnails and typically present on at least some of your other fingers. This is called the lunula. Most people think of it as simply a cosmetic feature of the nail anatomy, something that is just there. It is actually the visible portion of your nail matrix, the active zone where new nail cells are being continuously formed. And the color and size of your lunula is one of the most consistently overlooked diagnostic signals available on the human body. A reddish lunula has been significantly associated in research with valvular heart disease and congestive heart failure. The reddish coloration reflects altered blood flow dynamics in the nail matrix that accompany these conditions. A bluish or purplish lunula suggests problems with oxygen delivery in the circulation, similar to the cyanosis observed in more advanced cardiovascular disease where oxygenation of peripheral tissue is compromised. A lunula that has faded to almost nothing or become very pale is often a sign of anemia. And anemia places direct, measurable strain on the cardiovascular system because the heart must work significantly harder to compensate for the reduced oxygen carrying capacity of anemic blood, pumping more volume to deliver the same amount of oxygen to body tissues. All three of these lunula color changes warrant medical attention and conversation with a physician. A patient I will call Dorothy was 74 years old when her daughter, who happened to work in healthcare, noticed during a family gathering that the lunula shapes on Dorothy's nails had almost entirely disappeared. Dorothy herself had not noticed the change because it had been happening so gradually over months that she had simply adjusted her perception of normal without registering that something had shifted. Her daughter encouraged her to mention it at her next appointment. A complete blood count and cardiovascular evaluation revealed significant anemia and early cardiovascular strain. Both were identified and treated before anything more serious developed. Dorothy's daughter noticed something Dorothy had been looking at every day without seeing. The seventh sign combines a test you can perform on yourself right now with a clinical measurement that directly reflects your cardiovascular function. This is called the capillary refill test, and it measures how quickly your smallest blood vessels recover from pressure, which is a direct window into the efficiency of your cardiac output and peripheral circulation. Here is exactly how to do it. Hold your hand at the level of your heart. Use the thumb of your other hand to press firmly on one of your fingernails, pressing hard enough to push the blood out of the nail bed, which will turn it pale. Hold that pressure for approximately 2 seconds. Then release completely and begin counting the seconds quietly. Watch the nail bed. In a healthy adult with good circulation, the normal pink color returns to the nail bed in under 2 seconds. If you count to 3 before the color fully returns, test 3 or 4 other fingers on both hands. If you consistently get a slow result across multiple fingers on both hands, that is a meaningful clinical observation worth discussing with your physician. Research has linked persistently slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. Atrial fibrillation is one of the most common and dangerous heart rhythm abnormalities in people over 60. It frequently produces no noticeable symptoms while simultaneously creating a substantially elevated risk of stroke because the irregular heart rhythm allows blood to pool in the heart's chambers and form clots that can travel to the brain. A patient I will call William tried this test one evening after learning about it. He pressed his index finger and counted nearly 5 seconds before the color returned. He tested his thumb, the same slow result. He tested fingers on his other hand, consistently slow across all of them. He called the following morning and described exactly what he had observed and how he had performed the test. A full evaluation revealed undiagnosed atrial fibrillation. He was placed on appropriate treatment. Based on everything current cardiology literature tells us about the stroke risk associated with untreated atrial fibrillation in his age group, that phone call very likely prevented a major stroke within the following 12 months. He had no other symptoms at the time, none at all. The capillary refill test was the only signal his body had been producing that was visible enough to act on. Now, let us bring all of this together into a practical framework you can use starting today, because information without a clear action plan is just interesting conversation, and you deserve more than that. Find a window with good natural daylight, take both hands and examine each nail one at a time, working through the following in sequence. First, look at the overall color of each nail bed. Is it the healthy pink you would expect, or is there anything bluish, purplish, or unusually pale? Second, look at the very tip of each nail for that characteristic narrow reddish or pinkish band that signals Terry's nails. Third, look at the overall color distribution of each nail for the sharp two-tone division of Lindsay's nails, white near the cuticle and brownish red near the tip. Fourth, look across the surface of each nail for horizontal white lines that you can see clearly but cannot feel when you run your fingertip across the surface. Those are Murka's lines. Fifth, look for any horizontal grooves or depressions that you can both see and feel when you run a fingernail across the surface. Those are Bo's lines, and they tell the story of a past event. Sixth, look beneath the nail surface for any tiny, dark, vertical lines that were not caused by physical trauma to the hand. Those are splinter hemorrhages. Seventh, look at the base of each nail and examine the lunula for any reddish, bluish, or faded coloring, and notice whether the lunula is present and a normal size or has shrunk significantly. Finally, perform the capillary refill test on at least 3 fingers on each hand and count honestly. The most important practical step I can give you beyond the examination itself is this: write down what you observe, take a photograph of both hands in natural daylight today. Human memory across months is notoriously unreliable for subtle, gradual changes. A photograph gives you something honest and concrete to compare against 6 months from now, because these changes are slow and the comparison your memory makes between today and 6 months ago will not be as accurate as the comparison a photograph makes. If you observe one of these signs in isolation, mention it at your next routine medical appointment and ask specifically whether it warrants any follow up investigation. One sign in isolation may have an explanation unrelated to cardiovascular health. If you observe two or more of these signs together, do not wait for your annual checkup. Contact your physician's office this week, describe specifically what you observed and on which nails, and ask whether you should be evaluated sooner than your next scheduled appointment. The combination of multiple nail signs is more clinically significant than any single sign alone. One important boundary that I want to state clearly: what these signs do is give you a specific, informed, evidence supported reason to have a conversation with your doctor. They do not constitute a diagnosis. The full clinical picture, your complete medical history, your current medications, your other symptoms and risk factors, is what a physician uses to arrive at an accurate diagnosis. Your role in this is not to diagnose yourself. Your role is to notice, to document, and to speak up. That is the part that most people never do. And it is the part that makes all the difference in whether something is caught early or caught late. Robert's heart failure was caught early because his nails prompted the conversation that led to the echocardiogram. Catherine's heart failure was caught early because she mentioned the lines she had almost dismissed as nothing. Harold's silent heart attack was identified months after it occurred because the grooves in his nails preserved the evidence. Francis's heart valve infection was diagnosed before it progressed because she mentioned the dark lines she had almost decided were cosmetic. Dorothy's anemia and cardiovascular strain were identified because a family member knew what a disappearing lunula meant. William's atrial fibrillation was found before it caused a stroke because he performed a simple test at home and reported what he found honestly. In every one of those cases, the pathway from nail sign to diagnosis to treatment ran through the same essential step. Someone noticed something and told a doctor about it. That is the entire mechanism. Notice, document, speak up. Your nails have been at the end of your fingers your entire life. They have been recording what your blood is doing, what your heart is working at, what your smallest blood vessels are experiencing in a language that exists in the medical literature, but rarely gets translated into the plain language that reaches the people who most need to hear it. Every day that passes without knowing what to look for is a day that these signals exist without being read. You now know what to look for. You know Terry's nails and the reddish strip that makes them distinctive. You know Lindsay's nails and the sharp two-tone division that identifies them. You know Murka's lines that you can see but cannot feel. You know Bo's lines that mark the location of a past event in the nail's growth history. You know splinter hemorrhages and the cardiac infection they can signal. You know what the lunula's color and size are telling you. And you know how to perform the capillary refill test and count the seconds that tell you how efficiently your peripheral circulation is functioning. Take both hands to a window in the next 5 minutes. Do the examination while this is fresh. Take a photograph, write down what you observe. And if two or more of these signs are present, make the phone call this week. Your heart has been working for you every minute of every day for the entirety of your life. Your nails have been keeping records of that work. Now you know how to read what they have been writing.